Over 9 days last spring, part of London's Excel Centre was transformed into a huge intensive care unit for the very sickest COVID patients. Only 50 or so were ever treated here, but today it's reopened with a new purpose.
This is more like a community hospital, so we'll be working with patients who are recovering from things like surgery or maybe a fall, or maybe have had COVID but don't have COVID now, and they'll be coming here for the final week or so of their recovery.
You would have seen lots of ventilated space in Nightingale 1, but you can see this is a very different environment, much more homely.
The aim of this nurse-led Nightingale is to create space and reduce pressure at other hospitals, but trusts across London are contributing staff, including physios and occupational therapists.
Our biggest challenges, one is actually getting the workforce at the moment. That's a real big challenge that we're facing across the country. And I think for the patients that are coming here, we don't have any natural light, but it is only 5 to 7 days. So people will be here for a short stay, we'll get them ready and they'll get back home.
Because of the pressing need to open this facility and free up beds elsewhere, it's starting off on a relatively small scale, just 2 wards of 32 beds each, with around 8 patients admitted every day. But over time, there are plans to increase its size fourfold by bringing down that wall behind me, using more of the Excel Centre and opening a large-scale, fully equipped rehabilitation centre. It's not fast, is it? Is it really going to be enough to alleviate some of the pressure we've talked about?
Well, we're planning to do more if it's needed, so the plan is to grow more beds if we need them, so that's why we're in this hall now, and we're confident we can flex up, we will flex up if London needs it.
What sort of capacity would you have at the maximum, do you think?
Well, we're not sure at the moment. We're thinking around 290 at the moment, but it depends on what London needs and importantly, how we can staff and support the patients when they arrive.
We'd like to move to that blue dot.
At the other end of the Excel Centre, volunteers were making sure things ran smoothly on the first day of vaccinations here.
So it's a good thing I got the vaccine, and I'm so happy for that.
It's been a day of activity across this site as work continues to alleviate the pressure elsewhere. Katharine Carpenter, BBC London.